Thank you. Mr. Schweikert, you're recognized.
Thank you, Mr. Chairman. And Senator, you actually had a real influence on me years ago to spend more time on these subjects. And actually, I've listened to a podcast of the person sitting next to you. All right. And look, for a number of our friends here, thank you for tolerating me. As you know, this is one of my fixations. I also have been listening to a number of you. I don't think any of you are pushing the envelope hard enough, far enough. So let's actually walk through, and then there will be actually a question or two here. I'm the senior Republican of the Joint Economic Committee. We actually took a leap and did something we were prepared to get the crap kicked out of us. We did the math on obesity in America. We calculate that over the next 10 years, obesity in America may add an additional 9.1 trillion additional healthcare costs. And I was prepared for the incoming. You know what happened? A bunch of the people on the left and the right came to me and said, I can't believe you were willing to say it, but it's true. You have a country where we're about to have the 5th year in a row where prime-age males are dying younger. We look at the drug statistic. You know what's just about the drug statistic? Obesity. Family formation. We actually, it's Milken Institute, we haven't been able to reproduce the numbers, says 47% of all U.S. healthcare is tied to obesity. And in many ways, we also have data that in 4 years, more than half of America will actually be up against that number. And that's a little different than, what was it? Census of those produced a number the day, but it was a self-reporting poll. So it's crap as from a statistician standpoint. So I come to you and say, what do you do? Are you willing to take on the way we finance agriculture, the way we do nutrition support? I would argue, is it moral to give an EBT card to go buy onion rings? Look, I represent Scottsdale. I represent a very well-educated district, but I also have a tribal community that has very high per capita income, and yet it's the second highest diabetes in, I think, the world. And now, some of that's genetic. We've learned all sorts of things about the autoimmune issues within there. Diabetes now is 33% of all U.S. healthcare spending, 31% within Medicare. So I'm going to come to you and say, okay, we've been tracking the Vertex experiments on type 1, and it looks like the data is good. We've been actually trying to look at radical ideas of a fentanyl vaccine, because over the last 6 years, we've lost 380,000 of our brothers and sisters to fentanyl. We are on the cusp of amazing changes. The fact of the matter is we already have active lobbying all up and down this campus to slow down access to glutides, to semi-glutides. But the fact of the matter is the prices are starting to crash. Look at the price difference in the last 7 months from January till recently. Doctor, is it Hyman? Okay, you've been willing to do podcasts and long formats and walk people through. We're dying. In 14, 15 years, the United States has more deaths than births. How do I help our brothers and sisters understand that maybe the thing it's wearable, maybe the new technology where I can put something on my wrist and it counts my calories. It's not a Dexcom, it actually counts my calories, so it's not blood glucose. How do I socialize the technology? Because we have a data set from our joint economists, and for our ranking member, he may find this fascinating. Number one input in income inequality was not education, it's health. How would you evangelize a healthier America and the fact that it's the single biggest thing you could do for U.S. debt? Mike.
You said something very important, is we're not going far enough, and I'm honestly held back a little bit, to tell you the truth. I think we need sweeping changes across policies. I wrote a book called Food Fix, which lays this all out from field to fork. It's how we subsidize agriculture and the commodity crops that are driving the chronic diseases. It's what we pay for nutrition in terms of healthcare services. It's nutrition education. It's our dietary guidelines. It's our SNAP program that needs to be reformed. It's food marketing, particularly to children. It's front of package labeling with FDA. It's nutrition research that needs to be done by the NIH. It's so many different aspects across government. And the GAO produced a report at Dr. Mazzafaryan, who's in the audience, at my request, through Tim Ryan and Rosa Delario a number of years ago, that looked at all government policies related to nutrition and all the agencies involved. There were over 200 policies, 21 agencies. They found that most of these were working across purposes and actually causing more harm than good and creating more problems than solving problems. For example, we subsidize commodity crops that are turned into ultra-processed food, then we pay for $100 billion with the SNAP program, and then we pay for the back end on Medicare and Medicaid for those patients who are chronically ill. So the taxpayers are paying 3 or 4 times for the same problem, and we need to change that. So there's, I think, a set of sweeping policies that need to be done across the government that can really make a huge difference. And we may not be able to get them all done at once, but we have to work towards that. I think, slavery was at the center of our economy 150 years ago, and we figured out, not obviously through Civil War, I don't want to figure it out, but we figured out really how to end that and change our economy to something that actually created a more equitable society.
Yeah. Mr. Chairman, I thank you for your patience. I have an entire binder of articles and disruptions, and with your permission, I'd like to submit those for the record. And I do hope, actually, we can have some additional conversations, because I'm optimistic we're in the time of technology changes.
Yes.
Where the thing I can have on my wrist is actually almost my primary care, helping me.
I do think that
But it's the
AI-driven healthcare will create AI co-pilot for health, and it will create AI super docs that will transform healthcare. It's nothing we really talked about today, but I think it's part of what's happening outside of the traditional healthcare model, and I'm involved in that, and that's part of what our company, Functional Health, is all about.
Mr. Chairman, thank you for allowing my rambling.